Hello, Dr. Campbell and classmates of ISC 555. This is Deborah Utsey and Reagan McFarland as a representative of Team 1 of Katie Bay, Blake Milam, Reagan McFarland, Deborah Utsey. We consist of Team 1. We're going to navigate you through our EHR system that we have built for the clinic use that has met the guidelines of meaningful use. We will start out by accessing a patient form. Through accessing a patient form, we find Carol Johnson that we have pulled up her information. She's a patient, and by looking at Carol, we can actually see where we have added the functionalities of ethnicity and smoking status, and we have her gender. Of course, she's a female. We can go up, scroll back up a little bit and run a visit report on her. See, we are prompted to enter dates and try to see all the visits that she's ever had visiting our clinic. And there we have it. She was in 2012 with glaucoma, and just this year in September having problems with irritable bowel syndrome. We can go back and we've actually already have accessed her alerts, and because she's over 50, we find that she does need a mammogram, and she's due to be checked for shingles. These are clinical support decisions that Team 1 has entered and set up. She needs a colonoscopy, and she needs education to quit smoking. Now, if we were to unclick the fact that she's a smoker, it would take that away. So there's that functionality that we can add or edit and so forth. We can run another report on her. We can run a prescription report of all the prescriptions that she's had written from this clinic setting. We can tell that if we gave her refills or if we allowed generics, and what pharmacy that she uses. And we can see that she does have some entries. Okay, she was in the clinic today bothered with her glaucoma, or actually in 2012 on that day. Well, we could open up the patient education that we give her on that day for glaucoma, and it's signs and symptoms of it, things that she can do to manage her glaucoma better, and we can give her this nice patient education sheet to take home with her. Then on this day, we can actually edit this date. I'll pretend that it is today's date, and we're going to add today's date. We can change her diagnosis and give her, she's going to have maybe little symptoms of laryngitis. And we can she's still, even though she's got laryngitis, she needs to avoid, she needs to walk daily, but we can open up her a nice education sheet on laryngitis for today. When she's about ready to leave, we've given her prescriptions for some Zithromax, and we can add Zithromax to her visit for today. And we've about treated her and got her ready to go. We can give her, run a summary of care report, showing her everything that we have done for her today, and the medicines that we've given, and the fact that she is given a diagnosis of laryngitis. Okay, we pretty much have taken care of Carol Johnson today, and Reagan's going to talk to you about if a patient presents that's not in our system, what would we do?
So your patient came up to your registration desk and she wanted to be seen by Dr. Wood. So we would go to patient search, key in the patient's last name, and do search last name. And you can see that Ms. Utsey has never been to our facility before. So we need to put her into our system. So we'll close the screen and go to patient form. To access your new forms, all you have to do is click on this little highlighted yellow star and you'll get a blank form, and you can proceed to enter Ms. Utsey's information into the database.
We could add ethnicity, and she's got me smoking, so probably going to need some education before this visit's over.
When you get all that information checked, you can run a report and see. Well, we know she's never been here, so we're not going to run a report today because we already checked the database. We can check some alerts and see if she has any alerts. And she does because she's over 50. She needs a mammogram test. She needs to be she needs a shingles vaccine, the influenza vaccine, the pneumonia vaccine. She needs a colonoscopy because she's over 50, so we can ask her if she ever had one, and we need to encourage her to stop smoking.
These support decision alerts meet the criteria for meaningful use stage 2. Team 1 added 6 different clinical alerts to our program to better facilitate educational needs of our patients to provide better health care for them.
As Ms. Evers went into the room with the nurse begins to enter the information, the day's date. She's in today with an abscess. The nurse can write notes on exactly where the abscess is at and any procedures that she did to it. She can also enter Ms. Deborah's allergies into the computer system. And we're going to give her a summary of care before this visit is over with, so she'll know everything that we did for her. On abscess, since Ms. Deborah's never had an abscess before, we can open up patient education for her and print her off a nice handout so she'll know some treatments and the symptoms of an abscess and what she needs to do to avoid getting them. Also, because she has this abscess, we want to give her some antibiotics to take home. And see how simple it is to navigate the system and make corrections if need be. We're going to give her some. We're not going to give her any refills because if she's having a problem, we want her to come back to visit the physician. We'll give her some generics, and she's going to use CVS Pharmacy. When you come up here, you can go to Open Summary of Care Report. So when she goes home, she'll know everything that the doctor did for her today. So she has an abscess, and he gave her some Levaquin. She also has her patient education report to take home with her, telling her all the signs and symptoms. So when she leaves the facility, she's well informed of what's going on with her body and the procedures and the documentation that was done on it.
One other thing we'll just take a look at Mark Henry. He is about 83 years old, the best I recollect, and we will run a clinical alert on him and see if, well, maybe he's not 83. I thought we might see where he got alerted about his PSA. But if we were to change his birth date, say it has been a long time since he's been here, and we changed his birth date to 1932, and we check his alerts, there he goes. He needs a PSA test. So we hope you've enjoyed our presentation that Team 1 has compiled for our database, and we feel like we have met the requirements for meaningful use, and we can better serve our patients in our clinic setting. Thank you.